everyone, welcome to week 4. This week we will be covering chapters 29 to 33. So we start off in chapter 9 with an introduction to the autonomic nervous system. It's important that you can define the autonomic nervous system and you're familiar with its actions and what it regulates. It's also important that you're able to look at the two branches, the sympathetic and the parasympathetic, and you're familiar with how the branches differ. It will also be important in this chapter, if you are someone who makes flashcards or something to highlight, that you need to take a little bit of time to learn and memorize is the different receptors. So you should be able to identify your alpha 1 and alpha 2 receptors, as well as your beta 1 and beta 2 receptors. And you should have an idea of the location and the function of those receptors. Other than that, in chapter 29, make sure that you have a good understanding of how the sequence of events at the cholinergic synapse, but that isn't something that I will specifically test you on. Going into chapter 30, the adrenergic agonists, it's important again to have a strong understanding of what they are and what they do, and thinking about how they're used in the body and in medicine. On slide 26, there is a great chart on the physiological response of adrenergic agonists. It looks a little busy. You are not expected in any way to memorize it, but I would be familiar with what you need to take into account for safety considerations. So your respiratory tract, what it does to your respiratory rate, and your cardiovascular system and what it does to your cardiovascular system are the most important. Moving into chapter 31, adrenergic antagonists, there is on slide number 45 a similar pictorial demonstration of the sites of actions for adrenergic blockers. I think it's a very helpful guide. Again, focus on the safety more than anything. And make sure that you have a strong definition and understanding of adrenergic blocking agents and their therapeutic and adverse effects. Going on to chapter 32, cholinergic drugs. So these drugs are chemicals that act at the same site as the neurotransmitter acetylcholine. So you should understand what that means, why that medication would be desirable, and the most safe precautions that you need to take with nursing considerations and patient education. As you're reading your chapters, make sure that you are familiar with myasthenia gravis and the definition of symptoms, as well as Alzheimer's disease. Moving into chapter 33, the anticholinergic agents. These drugs are used to block the effects of acetylcholine. So it's important that you know why patients would require these drugs and their positive uses and outcomes, as well as the effects on the parasympathetic system. As we look at these medications, it's important to go back to half-life, what we discussed in week 1, and consider how these drugs are absorbed and how their half-life can vary based on the route that they are taken. You do not have any discussion boards or any virtual simulations this week. I'm sure you're aware that this will be your first exam. So please review all of your H5P matching activities. Those are the matching activities you've done in Moodle each week, and take advantage of the Prep U course practice questions. Look back over the chapters that you may have had a harder time processing the information, and really take the time to look at the questions and look at the explanations when you don't get a question right. As I always try to remind you, you're expected to spend 20 to 30 hours per week in this course. So this week there are 5 chapters assigned. If you spend 1 hour reading each of those chapters, reviewing the PowerPoint slides, you still have enough time that you should be able to go over your previous 3 weeks of information. Look at the study guides that you've been preparing or your flashcards, whatever method of studying you found to be most helpful. Look back through your virtual simulations. Feel free to do them again if they're helpful, and really take advantage of all of the electronic options that you have in CoursePoint. You will have 2 hours to take your midterm exam, and there will be 100 multiple choice or fill in the blank questions. All of these questions have been developed by the textbook editors, and I have gone through the chapters and selected which ones I think are most appropriate and most important. So the best way you can prepare for the exam is taking all of the practice questions and making sure that you're really familiarizing yourself when you get a question correct or incorrect over the rationale and why the answer was what it was. Please remember to take your exam in a quiet place, independently, and same with your quizzes. If something happens and your battery dies or you lose your internet connection, unfortunately your time will continue to tick. So if you were able to log back in, you will be able to complete your exam. But please be very thoughtful about where you take exams and make sure that there is secure internet access. And if you have any problems with that, consider plugging directly into your modem or taking another way to ensure that you'll have a safe Wi-Fi connection. I know you will all do great. You've been doing a great job so far this semester, and congratulations on being almost halfway done. Good luck.